Good morning, everybody. Welcome to this Executive Member for Health and Adult Social Care decision session. I'm Councillor Carol Runciman, and it's Wednesday, the 9th of December 2020. I hope that you will find it interesting, whether you're watching it live, watching the recording afterwards, or have seen it on YouTube. So I'll start going through the agenda. I have no particular declarations of interest. I've checked the minutes of the last meeting, and they are, as I can see, a correct record, and there is no public participation. This, of course, is being broadcast. It's being webcast at the moment. So, Peter, would you like to start by introducing the tobacco control plan and the smoke-free play park scheme?
Of course, thanks, Councillor Runciman. So the paper that we've got before us, as you say, has got two related components to it. So I'll talk about, first of all, the tobacco control plan for the City of York, and then a little bit about the smoke-free play areas work. The burden of smoking on health in York is still high. We see probably around 20,000 people a year who describe themselves as current smokers in the city at the moment, and it's the largest preventable cause of ill health. So from a public health perspective, I'm mindful of the council's duties and commitments to improve the health of its residents. Smoking and tobacco are really important, and supporting people to quit and preventing people from taking up smoking is something that we are putting some focus on, and have for a number of years supported that kind of work. And over the last year and a half, we've done a lot more work with partners on that, and about a year ago we started the York Tobacco Control Alliance, which I chair, which is a meeting of partners from different bits of the health and care and beyond system. So we have GPs, we have people from the hospital trust, from midwives, and lots of representatives from bits of the council, looking at tobacco and smoking and how we drive down the rates of people who smoke in York, and help and support them to quit smoking and get rid of an addiction. The work of the Alliance encompasses lots of things. So the Alliance has been looking at illicit tobacco and the market for tobacco which is sold at less than usual retail price, and taxes being avoided, which is one really well established mechanism for helping control tobacco, is the taxation of tobacco, and making sure that, for instance, regulations on sales to under 18s are really well enforced. We're looking at how we support people who are pregnant to stop smoking, which is something that's really important, both from their health but also the health of the child. And we look at things like the policies that different organisations might have and their workforce might have around smoking, looking at particularly how we support workforce and workplaces with that tricky decisions around smoking and electronic cigarettes, e-cigarettes. And then I guess lastly, the key thing that we do is try and support and maintain a really high quality cessation service that the council delivers, but also other bits of the health system in York that health professionals are helping people to quit in, if that's just a short brief intervention and conversation about smoking, or in some bits of York there are other areas which are offering that smoking cessation work. So the tobacco control plan wraps all of that up in a bit of a plan that the Alliance is leading on. It has got really good representation, as I was saying, across the system, and I think it's a really positive thing to have a plan for the city. And the reason we're bringing it to this decision session, obviously, it's a partnership plan, and the Health and Wellbeing Board have had a conversation about it. But a lot of the resource, the commitments within the plan, do fall on the council as the statutory body responsible for public health, but also other bits of the council, trading standards, our children's services colleagues, people working in social care. for whom there's commitments within these plans, and because of that, the council taking a really clear decision to sign it, we think is a really positive move, and I'm really glad to have the opportunity to put this to your decision session today, Councillor Runciman, and get the council's commitment to this.
Thank you. Peter, can you tell me who sits on the Tobacco Alliance?
Yeah, of course. So we have a couple of midwives from York Teaching Hospital Trust. We have a respiratory consultant and the community respiratory nurse who works out from the trust but in the community, mainly around asthma, COPD and other respiratory diseases which are heavily linked to smoking. We've got representation from York Against Cancer, or one of our voluntary sector organisations. We have the police and the fire service who are involved in the work, and we have lots of different bits of the council themselves: trading standards, public health, children's social care, adult social care, and on top of that, within public health, we have our Stop Smoking service, where we have a lot of practitioners involved, and a number of them attend as well. And then we have a GP representative who comes to represent the GP community, and primary care is really important within this. And we've got a number of other partners who have engaged with us really well. So pharmacy would be a good example of that, and community pharmacy in North Yorkshire. So it's quite a wide representation, and we're trying all the time to encourage new members to join. So if anyone is watching who would like to get in contact, we love people to engage on the work.
Tell me, are we seeing any reduction in smoking in the city?
So over the last decade, we've really seen a great reduction. Who can take the credit for that is an interesting question. And smoking is a national issue, and the reduction in rates is related to lots of things. I think people are getting the message that smoking is bad for them. However, tobacco is more addictive than heroin as a substance, and actually getting rid of that addiction is really hard. And that's why we try to create a culture in which we don't base things on blame or stigma. We base things on support, that it's really hard to get rid of tobacco from your life. So let's support you really well. Let's put the services in place that are based on the evidence, because there's really good evidence about what does and what doesn't work for quitting. The rates have really, I'd say they've halved over the last decade in York, from around about 1 in 5 to around about 1 in 10. The way that we measure smoking in York is through a national survey, which then breaks it down by local authority. By the time you get down to local authority, the numbers that are in the survey are not small, but they're not huge. So the rates fluctuate year on year a little bit. We can't put too much store by a small change, but we can say, compared to 2010, they are probably halved.
Tell me a little bit more about the smoking in play parks paper.
Yeah, so the council has directly about 50 play areas under its control. So these are facilities for children with adult supervision, more often than not with some kind of fence boundary, though some don't. They're dispersed across the city. We've probably got another 40 or 50 others that aren't within council direct control. They're owned by trusts or different organisations. So we're not talking about them in this paper. They're not under council control. But for the council controlled ones, they are areas in which obviously children are regularly present in, but adults supervising children. And also quite visible often at the centre of larger park and green space facilities, with lots of people using them that don't necessarily have children. And there are a few areas around the country which have implemented these smoke-free zones in children play areas. It's essentially based on the idea that there's really strong evidence children who grow up seeing smoking and smoking being normal are much more likely to smoke, and that actually is is quite well evidenced internationally and nationally. So a smoke-free area is meant to be a supportive measure. We want to cast it in terms of inspiring a smoke-free generation in York. It's not meant to be punitive, but it is meant to say, actually, for the good of the children that are using this park on a day-to-day basis, for their long-term health, you not smoking in this area really helps that. It will help create that smoke-free generation, the smoke-free norms for our children. And because of that, we're going to designate this a smoke-free zone, and smoking won't be allowed in this area. So that's the general principle. I think.
Would we encourage organisations like parish councils who have play parks to do the same, and perhaps provide them with, I don't know, posters perhaps, as well as information?
Absolutely. That's exactly what we'd like to do. If this works for our council parks, we'd like to then roll that out a bit wider and support the organisations that you mentioned, like parish councils, to do that with the graphics that we've used on our posters themselves, and answer any questions they might have, because there may be questions about how well does this go down with residents in York? Is this something that's generally accepted? Does this have an evidence base? And we can help with questions like that. So that's probably the third stage after the first stage being this conversation and the council approving it. That the second stage is that we are going to do a month-long public consultation on this idea. Obviously, it's bringing something of a new rule or regulation into York. We want to make sure the public have their say in that.
Yes.
So we're going to ask a really simple set of questions about how much people support this idea, this proposal, and have that publicly available on the council's website, on the consultation portal, so people, if they feel strongly about this, can have their say.
Yes, I was going to ask you how the consultation would be done. We want it as wide as possible, don't we? Yeah.
We do, absolutely, and we are going to be advertising it through parish councils, to ward councillors directly, and we have a number of Friends of Parks organisations in the city, and I think obviously with their remit, that's really helpful to do. I'd also encourage anyone watching who is a parent of young children, or feels strongly from a parental point of view, and also those who currently smoke as well as those who don't smoke. We want to hear all their voices.
I think there's a lot of people around who'd like to stop smoking, but as you say, it's very, very difficult, and they might well support our initiative and respond to the consultation. When will that consultation start and stop? Do you know yet?
Yes, it's going to run from I think the 4th of January until the 1st of February. Right.
That's good. So it gives us time to have a look at the results. I do know that the Health and Wellbeing Board, which I chair, will welcome this initiative, and obviously we can report back to them how it's going and what the response is. Are there any other matters, Peter, that you wish to draw to my attention on both those, the tobacco control plan and the smoke-free play parks?
Not at all, no. Thank you for your support, Councillor Runciman, on this, and it's great to have the Health and Wellbeing Board supported as well, and to have those partners around that table have discussed this already. So that's really positive.
Good, thank you. So I've considered the York Tobacco Control Plan, and I'm happy to have it adopted by the Council, and I've considered and agreed an introduction of voluntary smoke-free zones subject to public consultation. And I will look forward to seeing the results of that consultation when we have it. Thank you very much, Peter.
Thanks, Councillor Runciman.
Thank you, everybody.